Okay, the question may come as a 55-year-old woman has come to the emergency with acute precordial chest pain. Precordial means the part of chest that is lies over the heart. How do you proceed to diagnose the case? Or a 35-year-old female come to the emergency department with severe and sudden onset of central chest pain, that is precordial chest pain. Enumerate the causes. How can you investigate the patient? A 65-year-old male patient has presented in the emergency with the history of acute onset of severe retrosternal chest pain with sweating for last 3 hours. How will you approach this patient in making a quick diagnosis and management of the patient in next 1 hour? Or a 30-year-old male has come to the emergency with severe epigastric pain and vomiting. How do you proceed to diagnose this case? So we have the thing is chest pain, right? Chest pain with sweating or precordial chest pain or epigastric pain with vomiting. In all of these cases we have certain things. Let's talk about all of them. So first comes to mind is heart. Regarding heart, we have angina pectoris, acute MI, dissecting aneurysm of aorta, pulmonary embolism, acute pericarditis, regarding the esophagus, we have GERD, and Mallory Weiss tear. Regarding the abdomen, we have peptic ulcer, acute pancreatitis, acute cholecystitis, other than this we have regarding the ribs, we have costochondritis, we have trauma and rib fracture. Also we have a foreign body. Let's talk about all the important findings in each of this patient. Okay, let's make a tree first. make a human body. এক, দুই, তিন, চার, পাঁচ, ছয়, সাত, আট, নয়, 10, কুণ্ডল কুণ্ডল 2, 3, 4, 7, এটা হচ্ছে ট্রু, এই কটা হচ্ছে ট্রু রিবস। আট, নয়, 10 ফলস রিপ, 8, 9, 10, কারণ একটু গিয়ে লাগছে এর সাথে, গিয়ে লাগছে এর সাথে, 11 আর 12 হচ্ছে ফ্লোটিং রিপস। ফলস, বাকিগুলো ট্রু। তাহলে আমার কি কি হতে পারে? এটা হচ্ছে এখানে আমার হার্ট আছে, তো we have our heart here. First thing comes to mind with pain is regarding the heart. It is angina pectoris. Angina pectoris. With angina pectoris patient, what situations we have? The first one is chest discomfort associated with some kind of activity. অর্থাৎ কাজ করলে chest pain. Relieved by rest or nitrates. In this case, ECG is normal or ST changes. Next, regarding heart, this is left, is obviously myocardial infarction, acute MI with left ventricular hypertrophy. Left ventricular hypertrophy and left ventricular failure. In this case, what will happen? Here, the chest pain radiates to nape tip of shoulder, that means it will radiate to the nape of the human. Tip of the shoulder, back, shoulder, chin, back, inner aspect of arm অর্থাৎ বগল, along with chest pain. What we have, we will have blackouts, sweating, obviously sweating, and maybe vomiting. In this case, acute MI. Signs will be, signs means what will I will see: tachycardia or bradycardia, that means heart rate maybe raise, maybe down, BP maybe raise, maybe down, arrhythmia will be there, third heart sound will be there, GBP will be raised, and cold skin, cold clammy skin. In case of this, I have the ECG investigation. ECG, I have hyperacute T wave, ST elevation, pathological Q, wave, cardiac marker, troponin T or I, and CKMB. This cardiac markers will be raised. On echo, regional cardiac wall motion abnormality can be seen, ejection fraction, ESR CRP will be increased, ESR CRP, everything will be increased. Okay, next we have two things regarding heart here. Now let's talk about the pulmonary embolism, that means our lungs. Pulmonary embolism. Here the pain will be not radiating, so non-radiating chest pain. এখানে hemoptysis will be there, means রক্ত উঠে আসবে with cough. Breathlessness and blackout. On the signs will be same as tachycardia, cyanosis, central cyanosis, wide split S2, wide S2, loud P2, right ventricular gallop, this is right, so RV gallop. And in investigation, what I will see is on ECG simply R right ventricular enlargement, ESR will be increased, pH will be increased, pulmonary O2 CO2 will be decreased. Obviously it is about lungs. We'll do D-dimer test, and CT pulmonary angiography, Next is dissecting aneurysm of aorta. So I have here my, from the lung, from the left I have my aorta coming out of here. So dissecting aneurysm of aorta. Obviously I will see chest pain. That is extending downwards, What we'll do, obviously here BP may be high, maybe low, we'll do CT, D-dimer test. Next, regarding my esophagus. So I have from the esophagus, I have Mallory voice tear. What will happen here? Pain, after that bumi. What kind of bumi? Rokto bumi, that is hematemesis. So what we'll do, upper GI endoscopy. Next, what we have from this as well, we can have GERD, GE. What will happen here? Heartburn, excessive salivation, ডিসফেজিয়া অ্যান্ড রিগার্গিটেশন, অর্থাৎ খাবার গলা দিয়ে নামছে না এবং খাবার উঠে চলে আসছে, গিটেশন অ্যান্ড ডিসফেজিয়া, গলা দিয়ে নামছে না খাবার, খাবার উঠে চলে আসছে। So again what we'll do, upper GI endoscopy and esophageal pH monitor. Next is gastric peptic ulcer. What kind of pain? খাবার খেলে পেন হবে। ব্লোটিং, ভমিটিং, রক্তবমি, হেমাটেমেসিস। Here what kind of skin will be, signs will be there? Sign will be tender abdomen, cardboard like rigidity, cardboard like rigidity. What we'll do, upper GI endoscopy. Next is acute pancreatitis, that means from here, if this is my liver, I have my pancreas, and if this is my liver, so here I have my gallbladder is here. That's my other pen. My gallbladder comes here. Gallbladder is like this. It comes here. Here behind this thing is my pancreas. And I can have pain in both of them. So let's talk about first acute pancreatitis, because it is similar to this one, that is, in acute pancreatitis, chest pain in radiates to back in epigastrium, that means this area obviously, and it radiates to back. Just like acute MI, but in acute MI I have pain in shoulder, in chin, shoulder, back of arm, nape, everywhere. Okay, but the pain is not in the precordial area in acute pancreatitis. Here no pain, here a lot of pain. Okay, so investigation, serum amylase elevated, high serum lipase is high, and I will do USG abdomen. Next is acute cholecystitis, that this one. This is my gallbladder here. So acute cholecystitis. Here also the pain radiates to right shoulder. Okay. In acute cholecystitis. So here pain in the right abdomen, upper abdomen, and pain radiates to right shoulder. Sign positive Murphy's sign. Sign means what? I will palpate this part, and on inspiration it will be interrupted. শ্বাস নিতে নিতে থেমে যাবে patient. That is positive Murphy's sign. This is positive Murphy's sign. Pain suddenly interrupts the inspiration. So investigation will be USG abdomen. I still have some things like costochondritis, that means in the ribs. That's right. Costochondritis. This means inflammation in the cartilage connecting ribs to sternum. That means these parts. So here chest pain is localized and increases by coughing. Sign will be swollen tender joints, costochondral joints, obviously. Next is foreign body in the trachea. So this is costochondritis. And foreign body in trachea. Foreign body in trachea. Here will be chest pain, obviously, as per the question. Split of রক্ত উৎফুল্ল হবে, ব্লাড spitting and icy suction. Investigation will be chest x-ray. Next is the last one, that is সাইকোপিক, ঝগড়া করে আসে তখন হয়। It means that characteristics of pain doesn't match any condition. No clinical signs. That's it. That's the entire question. 30 minutes. Wow.